7, 6, 5, 4, 3, 2, 1.
Good afternoon. Thanks for tuning back into our channel. My name is Matt Law and I am a Medicare advisor here at Health Benefits Associates. Now today we have an exciting topic that we're going to talk to you about, which is why you would switch Medicare supplement plans during the annual enrollment period. We have a whole bunch of good information and we want to get your feedback. We're going to be allowing you to ask us questions throughout today's presentation at any time. So if you have a question, leave it in the comment section below and we'll get to your questions throughout the presentation. And we will have a larger Q&A at the end of today's presentation, so make sure to stay tuned until the very end. Now, if you've landed on this YouTube channel, you've probably been here before. We have a lot of great information and videos here to help explain Medicare, health and wellness, doctor interviews, you name it, it's probably going to be here on this YouTube channel. So I recommend hitting that subscribe button on our channel and liking this video so we can bring you more content like this in the future. Now, that's enough about the YouTube channel. Keep in mind that we have offices here in Reno, Sparks, and in Carson City for any of you who want to talk to us in person and get your questions answered face to face. So just know you can always walk into one of our offices and one of our Medicare advisors or team members will help you. And speaking of team members, we actually have something even more exciting to talk to you about today. The Health Benefits Associates team is expanding, and you guys know this. We have grown our offices into multiple areas in Northern Nevada, but we have a new team member that we are excited to introduce today. Someone that you've probably already seen on TV or seen around town. He's kind of a local celebrity, and he's now on the Health Benefits Associates team. And I'm really proud and honored to present and welcome John Potter, Health Benefits Associates. Hey,
hello, Mr. Answer Man.
Yeah.
How are you, folks? I just came out of hair and makeup.
Yeah.
Very nice. This is the very first Facebook Live that I've ever done.
Yeah.
And pretty soon, you'll see the very first TV commercial I've ever done. For these guys, because they really helped me out. I was turning Medicare age.
You can change your plan during your birthday month next year from one Medicare supplement plan into another without those health questions. You can also, last option, and I know there are a lot of options, but you can switch from a Medicare supplement plan into a Medicare Advantage plan, no health questions asked, during the annual enrollment period.
Okay.
When does the annual enrollment period end? Testing your knowledge again.
It's December 7th.
It is Pearl Harbor Day. So just keep in mind that December 7th is a month and a week away from today. So if you're looking at considering your options with Medicare Advantage, now is the time, especially before you start putting the turkey dinner on the table. It's probably a good idea to deal with insurance before Thanksgiving.
Entering another dimension. A dimension of choices. Choices that need navigating. Choices that will lead you to the Medicare zone.
Edward is starting his budget for next year. With a calculator in hand, he starts to realize that next year is going to be an expensive one. He knows that he needs hearing aids, cataract surgery, and several follow-up visits with his neurologist. Edward starts to panic. He starts researching new Medicare Advantage plans, but he gets confused. There are so many plan options with different benefits. What costs should Edward primarily focus on when shopping for a new Medicare Advantage plan? 1. emergency room visits. 2, hearing aids. 3, cataract surgery. 4, ongoing specialist visits.
Interesting.
Yeah, and not easy either. So if you guys watch that video, I want you to think about what you would answer in his situation, or what you would do for if you were Edward. All right, you guys, it looks like we got a bunch of people tuning in and putting in what they think Edward should do. Now, we also posted this on our Facebook a week ago, and we got some feedback from people who emailed us and who sent us messages. So we're going to compile all of this data and see who is, or what you guys think Edward should do. So, number 1, emergency room visits. A handful of you guys commented or said that you think that ER visits are important, which they definitely are. Have you seen the cost of an emergency room visit nowadays? Yeah. Don't go to the ER.
No, just be as healthy as you can, my goodness.
Yeah.
Mobility is everything.
Movement
Sorry to
is
go
life.
off topic here, but I make it a point. I'm a former runner, and now I walk. I find dumb reasons to walk, like go to 7-Eleven for coffee or Redbox to get a movie I don't even want to watch, but move. Avoid the emergency room.
We want to make sure that you guys, none of you guys go to the emergency room, but this is something I want you to think about when looking at Medicare supplement plans or even Medicare Advantage plans. Emergencies are actually covered at any emergency room in the United States on all plans. And if you have a Medicare supplement like a Plan F,
Yeah.
you're paying $0 for it. And Medicare Advantage plans are usually paying, $90 to $120, somewhere in that range in this area. So actually, believe it or not, regardless of the plan that you have, your emergency room costs are probably going to be pretty low. So that actually really wouldn't be a big thing to really focus on when shopping for plans. Now let's look at the second one, hearing aids. Now we got a few people who voted on hearing aids, and I know you made the joke about hearing aids earlier, but
Sorry.
yeah. You know what's not funny is hearing aids cost an arm and a leg. They can be about $3,000 to $6,000 nowadays. So if you don't have hearing aid coverage, like Medicare supplement plans do not have extra benefits for the most part. They usually do not include hearing aid coverage. You'd be out of pocket $3,000 to $6,000 for one hearing aid. That doesn't include the batteries either, which is unbelievable.
I keep hoping that technology is finally going to make things less expensive when it comes to that.
Oh, I hope so too.
I really do.
But in today's day and age, hearing aids are a very important component of people's healthcare and a very important part of the shopping process. So this actually would be one that I would say as a Medicare advisor, if you're coming into my office saying, I'm hard of hearing or I need hearing aids, I'm actually, one of the main focal points of the conversation will be shopping for a plan with hearing aid coverage, just with how expensive they are. Now, the third option, cataract surgery. Let's see here. We actually didn't get any votes on YouTube. I think we did get a few on our Facebook. And actually, cataract surgery is, it can be expensive and it can be a little bit intimidating to go into an ophthalmologist to get it approved. But when you have cataracts and you need that surgery, it's actually pretty easy to get that approved on a plan, and it's usually very inexpensive. Usually you're paying a minimal copay on a Medicare Advantage plan or a Medicare supplement plan. Like the Plan F, you're not paying anything. Plan G will probably be a couple $100. So once again, almost like the emergency room. Very important to focus on. I know you guys want to get your cataract surgery so you can see better, but when you see the bill, when you're on one of these Medicare plans, it won't be that expensive. Last multiple choice answer, which is number 4, ongoing specialist visits. It actually looks like we have quite a few people talk about specialist visits, which can get pricey. If you're going a lot and you have a lot of specialist visits, it can be expensive. But these Medicare Advantage plans or Medicare supplement plans, they have very low maximum out of pockets. So realistically, even if you went to the specialist once a day, if they're in network and they're approved, you're probably just going to hit your max out of pocket or spend a couple $100 or a couple $1,000. But realistically, hearing aids are actually going to be my vote on this for one of the most important components in the shopping process in Medicare. So just keep that in mind. And so when you guys think about what Edward should do, all of these are very important, but keep in mind that what you think might be important might not be the main focal point when you're shopping for plans. So always work with a Medicare advisor to figure out what you should be looking at when looking at plans.
There are some very good deals in some of these plans. I go to a heart specialist, and I actually feel sorry for him. I feel bad that I'm only paying $45 to see this great heart surgeon expert.
Yeah. And well, the thing is that the insurance plan is
he
paying
really
a lot
should
more.
be paid more from me.
Yeah.
I feel bad about that. I do.
Well, these insurance companies do pick up quite a hefty size of the bill. So your cost may be minimal, but these doctors are, still paid like they always have, and they're happy to see you as long as they're in network.
Good, because I feel guilty about that. I do.
Now, speaking of doctors, the last point that I actually want to touch on for today's Medicare conversation, why people switch Medicare plans, doctors list. Big thing with Medicare supplement plans. Did you know that every Medicare supplement plan, every insurance company works with the same doctors list? Did you know that?
Everyone?
Every Medicare supplement
Really?
plan, not Medicare Advantage, but Medicare
Is
supplement.
that a rule that they have to follow? Or?
It is.
Okay.
Any doctor that accepts federal Medicare,
Has to take.
take a Medicare supplement plan.
Okay.
So if you have insurance company A and you're trying to think, well, does the Medicare supplement plan through Medicare, through this insurance company, cover more doctors than this other Medicare supplement insurance company? No, it's the same doctors list. But one of the big things that we're seeing in this area is that doctors are not accepting a lot of new patients on Medicare supplement plans. And part of that is because of the federal Medicare reimbursement rate. Medicare supplement plans, even though it's a private insurance plan, the federal government is determining what those doctors are reimbursed, which in some situations can be pretty low. So if you have trouble getting into a doctor and you have a Medicare supplement plan, it's actually not the insurance company you selected, it's the fact that you have a Medicare supplement plan altogether, which is actually one of the main reasons why people are looking at Medicare Advantage in this area, is that certain Medicare Advantage plans may reimburse doctors at a better rate, which means those doctors are willing to accept new patients, and you can get in the door to more local facilities in town, which is not something that always used to be the case. This is something new that we've seen in the past, 2 to 3 years. So tell me, if you went to your doctor and they said, you have a Medicare supplement plan, John, which I know you don't, but let's say they said that, but we're no longer going to see you, would you want to switch your doctor or switch your plan?
The plan.
Yeah.
Yeah.
Doctors are really important, and we don't want you to switch your doctors. We want you to keep your health care, but sometimes switching plans is the only way to continue seeing those doctors that you've had relationships with.
One advantage to Medicare Advantage in terms of what I have, if ever there's an issue, I would imagine, I haven't had an issue with my plan, but if there is, I bet it's a bit easier working with them than it would be the federal government.
Yeah.
My experience just signing up for Social Security was a hassle, and getting somebody even on the phone is a real problem. I mean, it's a federal government, but we have these plans that there are local people to talk to about these things if you have an issue.
Well, we're always here to help, so keep in mind.
And you.
You don't have to deal with Uncle Sam when you have a Medicare supplement plan.
Yeah.
You can always just call us. If you're one of our clients, doesn't matter what plan you have, give us a call. One of our Medicare advisors is happy to help, and we'll help break through some of the complexities of this. But just know that Medicare plans and how doctors are reimbursed is really going to help you figure out which plans are going to have a stable network list, which plans are going to have doctors that accept new patients. And something that's actually newer in this area is now Medicare Advantage insurance companies have exclusive contracts with certain medical groups in town.
Okay.
You can only get into certain medical groups in town if you have a specific Medicare Advantage plan, which means little to no wait times. We got a few questions from our audience. It looks like Alice Gray has a question. Alice, thanks for tuning in. Aren't Advantage plans more restrictive on doctors? That's a tough question. It depends, and
On
so
the plan, yeah.
yeah, it depends on the plan, but also Medicare supplement plans are great for people who want to go to like Mayo Clinic or Johns Hopkins or MD Anderson. Those are high-end facilities, and as of today, Medicare supplement plans work really well with those plans. Maybe not with all the doctors here in town, but out of state, Medicare supplement plans are very strong. Here in town, Medicare Advantage plans, depending on who your doctors are, you may actually have better coverage here. So it really depends. Are you looking for coverage, Alice, here in town where you may be doing most of your healthcare needs, in the area? Or are you looking for those major facilities in the what if scenario that are out of state? So that's going to come down to your situation. We're more than happy to talk to you one-on-one, Alice, to figure out what you are trying to do and accomplish on your Medicare plan.
Education is everything. It helps you avoid costly mistakes. This is similar to my experience when my parents died and I was left with stocks. And I never was I never read a financial magazine. And I had these stocks and they were losing money because it was like old investments, oil and things like that. Well, oil kept going down stock-wise and I kept losing money. And I started reading Kiplinger's, and I got a great help from my guy at Fidelity. And I found that the more you learn, the less money you lose.
Yeah.
Really. And that was the big benefit of coming to see you. I don't know if it left to my own devices what I would have in terms of a healthcare plan right now. It wouldn't have been good.
Yeah.
It's just knowledge is power. Knowledge gives you confidence, and you make things easy to understand.
Let's see here. So we have Syl Scotsman. When can you change Medicare supplement plans? January 1st, 2022 or sooner? You can actually change Medicare supplement plans at any time of the year. There is no open enrollment period to switch a Medicare supplement plan. But now with the new legislation, the birthday bill. Yeah, the birthday bill. If you switch a Medicare supplement plan today, let's say you switch it for December 1st, 2021, you're going to have to answer health questions. But your birthday month next year, if you want to switch from, let's say, a Plan G to another Plan G with a different insurance company, we can help you do that. And AB 250 birthday bill says no health questions asked, which is very nice for anyone that was unable to switch from a supplemental plan into a new Medicare supplement plan based on any health history they had.
You got to really keep up with all these changes.
Yep. I'm always reading and always staying up to date, and we like to keep you guys up to date. So make sure to like this video and subscribe to our channel if you ever need more information on your healthcare or just Medicare news here in Nevada. Now, it looks like we have another follow-up question from Still Scotsman as well. Does the supplemental premium increase every year? Yes, it does. That is one of the growing pains of having a Medicare supplement plan, is that as you get older and as healthcare costs increase, which healthcare costs are just so expensive, your premium is going to increase by roughly 5 to 12%.
What plan are we talking about? B or
no? This would be like a Plan G, Medicare
Plan G.
supplement Plan G, which is very popular. I have a lot of clients in the Plan G, and they love it, but their price keeps going up every year.
I didn't know that.
Yeah.
Wow.
And this is one of the big things we were talking about, is that Medicare Advantage plans, we're actually seeing that those prices are going down, or they're already at zero and they're not changing.
No. I got the 2022 benefit list, compared it to the 2021 benefit list.
Yeah.
I was bracing myself because the darn car insurance company is always raising my rate, and I have a perfect driving record.
Yeah.
And so I thought it was going to be the same with this, but it's not.
Yeah, no, it's not.
It went up, I think, $5 for a hospital visit or something, and that was it.
And if you look at what a hospital bill costs, $5 is chump change compared to that. But to answer your question, Medicare supplement plans do increase every year, and they get to the point where they are just so expensive they don't make financial sense. But just be aware that every year you'll get a premium increase notice if you're on a supplement. Helene Munson, who asked, if you switch from an Advantage plan to a supplemental plan, Will the premium be more expensive than if you originally signed up for a supplemental plan? That's a really good question. And actually, on most insurance companies, the answer is yes. There are preferred rates when you initially turn 65 or you're initially eligible for Part B of Medicare. And those are going to be your lowest rates that you get on a Medicare supplement plan. But if you switch from an Advantage plan into a supplement, let's say at the age of 70, you'll get a tier 2 rate, which is a little bit higher, and basically you still have to pass those health questions to be enrolled. And if you do, your rate would be higher at that point compared to if you were 70 on that plan and initially signed up when you were initially eligible for Medicare. Next question is coming from Susie, who I know Susie. Hi, Susie.
Hey, Susie.
With an Advantage plan, is it difficult to get a referral from a specialist? And can you choose that doctor or specialist? I got some good news. This is actually one of the big reasons why Medicare Advantage is becoming more popular in this area. Even the HMO plans that are Medicare Advantage, most of them, not all of them, but most of them don't include referral requirements. Meaning if you just find a specialist in the network, anyone in the network that you want to go to, most of these plans are just allowing you to walk in their doors and schedule an appointment without that referral. And PPO plans in Medicare Advantage never have referral requirements. So this is something that's very different now, is that people used to not like Medicare Advantage. The rules, the hoops to jump through, all this stuff, right. A lot of those restrictions are not there anymore. So, I mean, when you, with your Medicare Advantage plan,
right,
which we're not going to say which one he has, but your plan, you do not have referrals. So if you wanted to go see a cardiologist, we would just find you a cardiologist and you would just go in their office and schedule an appointment.
Yeah.
Just like a Medicare supplement plan. So that is something where the tides have changed in the world of Medicare here in Northern Nevada, and a lot of rules have changed. So if you're worried about referral requirements on Medicare Advantage, probably want to take a look at it because a lot of these plans don't include it anymore. Okay, so I think that is all the time we have for today. We went a little bit longer, but the thing is we had a great conversation. I had a lot of fun with John, and we're going to be doing a lot more of this in the future. So if you enjoyed this today, like the video. And you know what? John, I know, would really like that because he likes being in front of the camera. So we're going to put him in front of the camera more and more. And so to make sure to subscribe to our channel to see more videos with John Potter and myself and the other Medicare advisors here.
I got nothing else to do, folks.
Yeah, he's got nothing else to do except have fun with us.
Thank you for putting me back on the camera, yeah. And thank you for not cutting me off the air.
Okay, well, we got to... So our next presentation is actually a month from today. It's on December 1st with Alex Sampson in our office. He will be talking about the biggest mistakes made in the annual enrollment period, which the annual enrollment period ends on December 7th. So you definitely want to tune into that just to make sure you checked all the boxes before the deadline hits. To one of our in-person events that we have here in town or in Carson City. And we also have a seminars page on our website that will list all of the events that we do virtually and in person so you can learn more about Medicare.
Yeah, I'd like to attend some of those.
You absolutely, events. And guess what? He actually will be.
Well, sure. No, like I said, I got all the time in the world. So keep me busy.
Well, one of them is going to be...
I miss being busy.
Well, he's going to be very busy, and we have an event coming up called the Ageless Expo, which will be throughout Northern Nevada. And so Grant Dodge in our office, Alex Sampson, and John Potter will be there to chat with you, to get to know you, but also find the right Medicare plan.
That'd be awesome.
Yeah.
That's great.
Now we're going to sign off for the day. My name is Matt Law with Health Benefits Associates.
Nice to meet you all here, folks. John Potter, and I'll see you again.
See you next time.